Most heart attacks give warnings weeks or months before they happen. The doctors completely miss. I'm going to share 7 early warning signs of heart disease with you today that could save your life. These aren't the classic symptoms everyone knows about. These are subtle signs that appear weeks, months, or even years before a heart attack. Most doctors miss them completely because they're not looking for them. I've spent 15 years in preventive cardiology. I've learned that by the time someone has chest pain, their heart disease is already advanced. The key is catching it early when it's still preventable and reversible. Today, I'm going to teach you what to look for. Let me ask you something. Do you ever feel unusually tired? Does climbing stairs leave you more breathless than it used to? Do you have pain in your jaw or neck that seems unrelated to anything? Do you wake up at night needing to urinate frequently? What if I told you these symptoms could be early warnings from your cardiovascular system? What if your body is telling you right now that your heart needs attention, but you're missing the signals? I'm going to teach you to recognize these warnings, because catching heart disease early is the difference between prevention and emergency. Here's what frustrates me about how we handle heart disease in this country. We wait for the crisis. We wait for chest pain. We wait for the heart attack. Then we rush the patient to the emergency room and try to save them. But heart disease doesn't develop overnight. It develops over decades. Your arteries don't suddenly clog. They narrow gradually year after year, and during that entire time, your body is sending warning signals, subtle signs that something is wrong, but nobody is paying attention. Most doctors only screen for heart disease with basic tests: blood pressure, cholesterol, maybe an EKG. These tests catch advanced disease. But they miss the early stages, when intervention could prevent everything that comes later. And here's what really concerns me. Heart disease is still the #1 killer in America. Someone has a heart attack every 40 seconds. Someone dies from heart disease every 36 seconds. Many of these deaths are preventable if we catch the warning signs early. Think about what happens if you miss these signs. A heart attack out of nowhere. Maybe you survive. Maybe you don't. If you survive, your heart is damaged. Your function is reduced. You're on multiple medications. Your quality of life is compromised. Your risk of another event is high. That's not a future you want, so let's prevent it right now. Warning sign number 1, unexplained fatigue. The first and most commonly missed warning sign is unexplained fatigue, especially in women. This isn't normal tiredness from a busy day. This is profound exhaustion that's out of proportion to your activity level. Here's what's happening. When your coronary arteries narrow, your heart can't pump blood as efficiently. Your body isn't getting adequate oxygen delivery to tissues. You feel tired, exhausted, drained, but you attribute it to aging, stress, or poor sleep. You don't recognize it as a cardiac warning. Women especially experience fatigue as the primary symptom of heart disease. Studies show that 70% of women who have heart attacks experienced unusual fatigue in the weeks or months before the event. But they didn't recognize it as cardiac. They thought they were just tired. This fatigue is different from normal tiredness. It's disproportionate. Simple activities that used to be easy now exhaust you. Carrying groceries wipes you out. Making the bed leaves you needing to rest. This is your heart telling you it's struggling. But most people ignore this symptom. They push through. They drink more coffee. They assume they need more sleep. Meanwhile, their heart disease is progressing. I had a patient, Linda, 57 years old, who came to see me for fatigue. She'd been exhausted for 6 months. She could barely get through her workday. Her primary care doctor ran standard labs. Everything looked normal. He told her she was stressed and needed to exercise more. I dug deeper. I asked about her family history. Her father died of a heart attack at 62. I ordered a cardiac calcium score and stress test. Her calcium score was high. Her stress test was abnormal. She had significant coronary artery disease. The fatigue was a cardiac warning. If we hadn't caught it, she would have had a heart attack within months. We treated her aggressively. Medications, lifestyle changes. Within 3 months, her energy returned. She avoided a heart attack because we recognized the warning sign. Your action step, if you're experiencing unexplained fatigue, especially if it's disproportionate to your activity level, if it's getting progressively worse, or if you have cardiac risk factors, get evaluated. Don't ignore it. Tell your doctor, I'm experiencing unusual fatigue. Given my risk factors, I want cardiac testing. Request a stress test or cardiac imaging. Don't accept you're just stressed as an answer if this fatigue is new and unexplained. This symptom saves lives when it's recognized. Don't dismiss it. Warning signs Theberton 2, shortness of breath with minimal exertion. The second warning sign is becoming short of breath, with activities that used to be easy. Walking up a flight of stairs, carrying groceries, walking across a parking lot, you find yourself stopping to catch your breath. Here's what this means. Your heart isn't pumping efficiently enough to meet your body's oxygen demands during even mild exertion. This is called exertional dyspnea, and it's a major red flag for coronary artery disease. When your coronary arteries are narrowed, your heart muscle doesn't get enough oxygen during increased demand. Your heart struggles. Your body compensates by increasing breathing rate. You feel short of breath. This often happens long before you experience chest pain. Many people attribute this to being out of shape or getting older. They think, I just need to exercise more. But if you're becoming breathless with activities you could previously do comfortably, this is a warning sign that needs evaluation. I worked with a man, Robert, 63, who noticed he was getting winded walking his dog. This walk used to be easy. Now he had to stop twice to catch his breath. He assumed he was out of shape from the pandemic. His wife insisted he see me. We did a stress test. He couldn't complete it. He became severely short of breath and developed EKG changes indicating ischemia. Cardiac catheterization showed 90% blockage in his left anterior descending artery, the widowmaker. He was days or weeks from a massive heart attack. He had emergency stenting. The blockage was opened. His shortness of breath resolved completely. That symptom had saved his life by bringing him in before the heart attack. Your action step. If you're noticing new or worsening shortness of breath with activities that used to be comfortable, get evaluated immediately. This is not normal aging. This is a warning. Track your symptoms. Can you walk as far as you could 6 months ago? Can you climb stairs without stopping? If the answer is no and there's been a decline, see a cardiologist. Request a stress test. This will show whether your heart is getting adequate oxygen during exertion. If it's not, further testing is needed. Don't wait. Shortness of breath is often the only warning before a major cardiac event. Warning sign Nuxna 3, gum disease and dental problems. The third warning sign that most doctors completely miss is periodontal disease, gum disease. There's a powerful connection between oral health and heart health that very few people understand. Here's the link. The same bacteria that cause gum disease enter your bloodstream through inflamed gums. These bacteria trigger inflammation throughout your cardiovascular system. They contribute to the development of atherosclerotic plaques in your arteries. They increase your risk of heart attack and stroke. The research is clear. People with periodontal disease have 2 to 3 times the risk of heart attack compared to people with healthy gums. People with severe gum disease have even higher risk. Yet most doctors never ask about dental health when assessing cardiac risk. Additionally, chronic inflammation from gum disease elevates systemic inflammatory markers. This inflammation damages arterial walls and accelerates atherosclerosis. Your mouth is literally destroying your heart. But most people don't connect dental problems with heart health. They ignore bleeding gums. They skip dental appointments. They don't realize they're increasing their cardiac risk significantly. I had a patient, James, 59, who had elevated inflammatory markers on his labs. His CRP was high, his cholesterol was borderline, he was at moderate cardiac risk. When I asked about his dental health, he admitted he hadn't seen a dentist in 5 years. His gums bled when he brushed. I sent him to a periodontist. He had moderate to severe periodontal disease. He underwent deep cleaning and treatment. Within 3 months, his inflammatory markers dropped significantly. His CRP normalized. We had reduced his cardiac risk by treating his gums. Your action step: take your oral health seriously. It's directly connected to your heart health. See a dentist twice yearly for cleanings and checkups. If you have bleeding gums, pain, or loose teeth, see a dentist immediately. Get any gum disease treated aggressively. Brush twice daily, floss daily. Use an antiseptic mouthwash. These simple habits reduce systemic inflammation and protect your heart. If you have gum disease and cardiac risk factors, inform your cardiologist. They may want to check inflammatory markers and assess whether your oral health is contributing to cardiovascular risk. Your mouth and your heart are connected. Protect both. Warning sign number 4. Leg pain or cramping when walking. The 4th warning sign is leg pain or cramping that occurs when walking and goes away with rest. This is called claudication, and it's often the first sign of peripheral artery disease, which means you likely have coronary artery disease too. Here's why this matters. The same atherosclerotic process that clogs the arteries in your legs clogs the arteries in your heart. If you have peripheral artery disease, you have a 50% chance of having significant coronary artery disease. But most people don't make this connection. The leg pain happens because narrowed arteries can't deliver enough blood to your leg muscles during exertion. The muscles become starved for oxygen. They cramp or ache. When you rest, blood flow catches up. The pain resolves. This cycle repeats. Many people attribute leg cramping to aging, dehydration, or muscle strain. They don't realize it's vascular. They don't get evaluated. Meanwhile, their coronary arteries are just as narrowed as their leg arteries. If you have claudication, your risk of heart attack is dramatically elevated. This symptom is a warning that your entire vascular system needs attention. I worked with a woman, Patricia, 66, who complained of calf pain when she walked more than 2 blocks. She'd rest for a minute and the pain would go away. She thought it was arthritis or tight muscles. She didn't mention it to her doctor for a year. When she finally did, her doctor was smart enough to recognize it as vascular. We did an ankle brachial index test. Her blood flow to her legs was significantly reduced. We then did cardiac testing. She had 3-vessel coronary artery disease. She needed bypass surgery. Her leg pain had been warning her that her heart was in danger. Your action step: if you experience leg pain or cramping that occurs with walking and improves with rest, get vascular testing immediately. This is not a muscle problem. This is a circulation problem. Tell your doctor about this specific pattern. Request an ankle brachial index test. Request cardiac evaluation. If you have peripheral artery disease, you need comprehensive vascular assessment. This symptom is a gift. It's your body warning you before the heart attack. Listen to it. Warning sign the 5, frequent nighttime urination. The 5th warning sign that surprises most people is getting up multiple times at night to urinate, especially if this is a new pattern. This can be an early sign of heart failure or significant heart disease. Here's what's happening. During the day when you're upright, gravity causes fluid to pool in your legs and feet. If your heart isn't pumping efficiently, this fluid accumulation is worse. At night, when you lie down, that fluid redistributes back into your bloodstream. Your kidneys filter it out. You have to urinate frequently. This is called nocturia, and when it's new or worsening, it can indicate that your heart isn't pumping blood efficiently. Your body is compensating by redistributing fluid at night. Most people attribute frequent nighttime urination to aging, prostate problems in men, or bladder issues in women. They don't consider that it might be cardiac. But when this symptom is combined with other warning signs, fatigue, shortness of breath, leg swelling, it's often heart-related. I had a patient, Michael, 61, who started getting up 4 times per night to urinate. This was new over the past 6 months. He assumed it was his prostate. His urologist found his prostate was normal. He was referred to me. I examined him and noticed mild ankle swelling. His blood pressure was elevated. I ordered an echocardiogram. His heart function was reduced. His ejection fraction was 35%. Moderate heart failure. His nighttime urination was his body trying to eliminate the excess fluid his weak heart was causing to accumulate. We treated his heart failure. His heart function improved. Within 2 months, he was only getting up once per night. The nocturia had been a cardiac warning. Your action step: if you're getting up more than once per night to urinate, and this represents a change from your baseline, consider cardiac evaluation, especially if you have other risk factors. Track your symptoms. Note any ankle swelling during the day. Note any shortness of breath. Note any fatigue. If multiple symptoms are present, cardiac evaluation is warranted. Tell your doctor, I'm having increased nighttime urination along with these other symptoms. I want to rule out cardiac causes. Request an echocardiogram to assess heart function. This symptom is easy to dismiss. Don't dismiss it if it's new and worsening. Warning sign number 6. Indigestion, nausea, or stomach discomfort. The 6th warning sign is persistent indigestion, nausea, or upper abdominal discomfort, especially if antacids don't help or if symptoms occur with exertion. Here's why this happens. When your heart muscle isn't getting enough oxygen, a condition called ischemia, it can cause referred pain to areas served by nearby nerves. Your brain interprets this as stomach discomfort or indigestion. You think you have a digestive problem when you actually have a heart problem. This is particularly common in women. Studies show that women are more likely to experience atypical cardiac symptoms like nausea, indigestion, and abdominal discomfort, rather than classic chest pain. Many women having heart attacks are misdiagnosed with gastric problems and sent home. If your indigestion or nausea occurs with exertion, walking, climbing stairs, emotional stress, and improves with rest, this is a major red flag for cardiac ischemia. This pattern indicates your heart isn't getting enough blood flow during increased demand. But most people take antacids and ignore it. They assume it's something they ate. They don't connect digestive symptoms with cardiac problems. This delay can be fatal. I had a patient, Sandra, 54, who experienced nausea and upper stomach discomfort for 3 weeks. She took antacids. They didn't help. She thought she had an ulcer or gallbladder problem. When she mentioned that the symptoms were worse when she exercised, I became concerned. We did a stress test. It was severely abnormal. She had critical blockages in multiple coronary arteries. Her indigestion was angina. She was on the verge of a massive heart attack. She had emergency bypass surgery. Her digestive symptoms completely resolved after surgery because they were never digestive at all. Your action step. If you have persistent indigestion, nausea, or upper abdominal discomfort, that doesn't respond to antacids, especially if it occurs with exertion or stress, get cardiac evaluation immediately. Note the pattern. Does it happen with physical activity? Does it improve with rest? If yes, this is cardiac until proven otherwise. Don't assume it's digestive. Tell your doctor, I have these symptoms with exertion. I want cardiac testing before we assume this is gastrointestinal. This atypical presentation kills people because it's not recognized. Recognize it. Warning sign, these may 7. Sudden excessive sweating. Same. The 7th warning sign is sudden, unexplained sweating, especially cold, clammy sweating that occurs with minimal exertion or at rest. When your heart is struggling, your body activates the sympathetic nervous system, your fight or flight response. This causes sudden sweating, particularly cold sweating. It's your body's stress response to your heart not functioning properly. This symptom often occurs during cardiac events. People having heart attacks frequently describe sudden onset of cold, clammy sweating. But this can also occur with stable angina or as a warning sign weeks before an event. Women particularly report sudden sweating as a primary symptom of heart attack. They describe it as sudden drenching sweats, cold sweating, or breaking out in a sweat for no apparent reason. If you experience sudden sweating with other symptoms, chest discomfort, shortness of breath, nausea, fatigue, this is a medical emergency. But even if sweating is your only symptom and it's new and unexplained, it warrants evaluation. I had a patient, Karen, 62, who experienced sudden episodes of sweating. She'd break out in a cold sweat for no reason. She attributed it to menopause, though she'd been through menopause years earlier. The episodes were increasing in frequency. She mentioned it during a routine visit. I took it seriously. We did cardiac testing. She had significant coronary artery disease. Her sweating episodes were cardiac. We treated her aggressively. The sweating episodes stopped. We prevented what would have been a heart attack. Your action step: if you experience sudden, unexplained sweating, especially cold, clammy sweating, that occurs with minimal exertion or for no apparent reason, get evaluated immediately. If sweating occurs with any other symptoms, chest discomfort, shortness of breath, nausea, arm pain, call 911. This could be a heart attack in progress. If it's isolated sweating but it's new, unexplained and recurring, see a cardiologist. Request cardiac testing. Don't attribute everything to menopause or stress. Trust your instincts that something is wrong. The transformation. Now let me tell you what happens when you recognize these warning signs and take action. You notice one or more of these symptoms. You don't dismiss them. You get evaluated. Tests reveal early heart disease. You're not having a heart attack. You're not in crisis. You caught it early. You start treatment. Medications to protect your heart. Aggressive lifestyle changes. Diet. Exercise. Stress management. Smoking cessation if relevant. Within 3 months, your symptoms improve. Your fatigue lessens. Your shortness of breath decreases. Your cardiac risk drops significantly. Within 1 year, your heart disease has stabilized or even reversed. Your arteries are healthier. Your heart function is better. You've prevented what would have been a heart attack. 10 years from now, you're still here, still healthy, still active. You avoided the heart attack. You avoided the emergency room. You avoided death. You're living fully because you recognized the warnings and acted on them. This is what happens when we catch heart disease early. We prevent the crisis. We change the trajectory. We save lives. Final thoughts. I want you to imagine something with me. It's 1 year from now. You experienced some of these warning signs, but you ignored them. You dismissed the fatigue. You attributed the shortness of breath to being out of shape. You ignored the leg pain. You thought the indigestion was just stress. Then you have a heart attack. Maybe you survive. Maybe you don't. If you survive, your heart is permanently damaged. Your ejection fraction is reduced. You're on multiple medications. Your quality of life is compromised. You live with the knowledge that it could have been prevented if you'd paid attention to the warnings. Now imagine the alternative. You recognized these symptoms, you got evaluated, you caught the heart disease early, you treated it aggressively, it's 1 year later, and you're healthy. Your heart is protected. You avoided the crisis. You're living the life you want to live. Which future do you want? Your body is sending you signals right now. Don't ignore them. These 7 warning signs exist to protect you. They're giving you time to intervene before it's too late. So here's what I want you to do right now. Review these 7 warning signs. Do you have any of them? Even one? If yes, schedule an appointment with your doctor this week, not next month. This week. Tell them about your symptoms. Request cardiac evaluation. Be your own advocate. If you don't have symptoms, but you have risk factors, family history, high blood pressure, high cholesterol, diabetes, smoking history, get baseline cardiac screening. Don't wait for symptoms. Your life may depend on recognizing these warnings. Take them seriously. Act on them. Get evaluated. If this video helped you, share it with everyone you know. These warning signs save lives. The more people who know them, the more lives we save. And if you want more life-saving medical information, evidence-based medicine that prevents disease and saves lives, subscribe to this channel. I post new videos every week. Your heart has been beating for you every second of your life. Now it's your turn to pay attention to its warnings.